interview with none other than Jennifer Gularson.
Thank you.
Thank you for coming by. I appreciate it.
Well, who wouldn't like this place?
Yes,
it's amazing.
So it is. So before we get into the interview, I just wanted to thank Up on Market. They're located in Historic Frederick, Maryland. Gorgeous little French bistro and inn, very authentic. I'll probably do a full tour on that, but Francis is taking good care of us. You're having, what are you having?
I'm having
A Bordeaux.
Yeah, it's a white wine. Bordeaux, yes.
And then I'm
sort of
doing-
like a Sauvignon Blanc.
Yes, okay.
Using Bordeaux.
Yeah, and then I'm having a nice little mocktail that Francis made for me. So,
Blood orange,
yes,
blood orange
I
and
know.
grapefruit.
Yes, so here's to your health. Speaking.
Cheers.
I'm going to take that off to the side. So today we're going to be talking specifically, I'm going to go through, I have some questions here for Jen, but talking about threading. It's also known as sugar threading, PDO threading. I think there are a few other
Thread
names.
lift.
Thread lift. It's the thing that everybody's starting to talk about, kind of filling that gap area for people like myself that are of a certain age. Maybe their skin is changing a bit, but I don't want a facelift, and I don't want something so invasive, and you get immediate results. So Jen, and we've done a few threads on me already. I think if you follow me on my Instagram and Jen's Instagram, which I'll link all of those things below, and all of Jennifer's information as well will be linked below. But we've done some collagen building threads and barbed threads. I've had 2 here, collagen here, and then 2 here and here for lifting, and I love it. I am so happy, and we did some things on my stomach too. So there's just so much, but let me ask you some questions. Jennifer, why did you decide to bring threading into your practice?
One of the main reasons is that we've had fillers, and we've been doing fillers for years. The fillers have a really specific place, but you can only plump things up so much. And I think, in Hollywood and in Miami, we can get away with those big cheeks or overinflated cheeks to take up volume, but adding a little volume, yes, but then you also want to lift things.
Yes,
reposition fat pads and reposition your skin. So fillers cannot do that.
Right.
And people don't like being poked every 6 months.
Right, and also just getting, for me, with fillers, I think right now I might need a little in here since we've done some threading and Botox, but I don't want to be too round looking, I guess.
You want that.
Yeah, you want more of that triangle face and that thing that's very youthful and lifting, I think, and is hugely popular in Asia, right? Korea specifically.
Yeah, so I think it fills a very nice gap, and it's just a logical progression.
Right.
For somebody who's young like yourself, who isn't ready for a facelift, or who maybe people don't want a facelift, they just want something non-invasive.
And then not the downtime, or just like being afraid. A facelift is a full, you're under surgery, and a lot can happen. And I'm not saying that I won't do a facelift.
I'm not crossing that off my
No,
list.
I'm never. So, and then why, there are a few things on the market. Why did you choose PDO Max, which is a brand of threads, correct?
Correct. Well, after researching, I think you want to use something that's very safe for your patients, and PDO Max has gone that extra step and got FDA cleared. So there's a difference between FDA approved, which is a drug or a pharmaceutical, that's FDA approved, but this is FDA cleared because it's technically a device. So Giovanna has gone the extra mile and gotten FDA cleared, done many research, a lot of white papers, we call that, in the biz, so that I know that the product is safe.
Okay. I mean, that's good to know. And Jen, just for the record, very conservative, so Jen takes care of all of my injections. But that I like the fact that you do your research, and that you're saying to do like a little bit of all of these things to kind of help feel good about aging. We're all, thank God, knock on wood, that we will continue to age. We're not stopping aging.
We're not rolling over.
Right, and not giving up either over whatever. I'm not even going to say it. So you brought some threads with you. What are PDO threads? What are they?
So they are dissolvable sutures. So like if you had your appendix taken out, a lot of times they'll stitch you back up with dissolvable sutures. So these threads, they come in 2 different kinds.
Do you have some?
I do.
Okay. And I'll zoom in and insert some other pictures here.
I'll let you hold this one. This is the barb.
Okay.
They're a little bit longer.
Okay. And we'll, like I said, we'll get another picture. So yeah, you could really see. I don't know if you'll be able to see on this. You keep talking while I'm doing this.
So the barbed sutures are for lifting, and they are inserted underneath your skin. You're anesthetized, so you can't feel that, and then they are housed in a catheter. So it's like a long needle, but it's blunt at the end, so it doesn't hurt, and you're tunneling underneath your skin, and then you're depositing this thread, and then it's coming out. You'll see on some of my pictures. I'll insert when we did it, and I will put a disclaimer.
I don't want to put anything that's too graphic, but it is a procedure.
So as you put it in, when you pull them a little bit, it causes a little bit of traction, and then the barbs sort of come out, and then they attach to the underlying skin and the skin over this. Yes. And then over time, since that's laying there if you picture this as the suture or the threading material, you're going to build collagen in 360 degrees around that suture, so that as this slowly dissolves over about 6 to 9 months, your collagen sort of takes over.
Your body helps it that, right? More of the lift.
So after 6 to 9 months, you are not all of a sudden going to have
and it's not going to fall.
But you are going to continue to age.
Yes.
So that's why good skincare helps the whole process.
Right.
So that's the barbed suture.
Okay.
And then the straight.
So barbed are for lifting.
Barbed pulling up.
Okay.
And that's used all over the body, but then also neck up here. Just think when you start pulling like this.
Yeah. All of it.
And then you have the straight.
What other places? Your butt, your this, your stomach, breasts, anything you could think you want to lift. We're gonna try it.
Now, if you've done any research or YouTubing the PDO threads, these are probably the ones that come up the most.
Yes.
This is the ones that are the smooth, and they are all over your neck. In Korea, they
put them all. They put like 20.
Oh, lots more than that.
All over your face like a spider.
So the idea here is it's a needle with a thread, and it just deposits a thread that again lays there, and then you're building collagen around it. So it stimulates your collagen. It helps to make the skin quality a little bit thicker, which is
take care of deficits too, things that are missing. It's interesting. Is it basically? I don't know, but because you're injuring your body a little bit, does it go into like, okay, now we have to send everything there to repair?
So the needle actually instigates like, hey, something's going on, and then things come in, and then the fibroblasts start making collagen.
Okay.
Sort of dissolve. It helps to dissolve it, but then in dissolving it, you're also creating some collagen that you're going to benefit from on and on. Like this morning, I did a younger patient who had some acne scarring, and she was starting to get a little bit of deficit right here.
Okay.
So we did the mesh, or the hashtag.
They go here and here.
So we did 4 and 4.
Yeah.
It was nice. It takes just a few minutes. The pain is minimal because the needles are very small.
Yes, the pain is minimal, but I'll tell you what I have found with it, and I was telling Jen too. So the collagen ones are different. The lifting ones, you'll have where she numbs you. A few places when you feel it, it's not horrible painful, but it's not
a zinger.
Great.
You'll get a zinger.
But what was interesting with the collagen threads, as they dissolved, a week later, everything had healed, no downtime. It felt like all of a sudden if I made a face or did something, sometimes like a rubber band snapping and doing something. And it's crazy. And those are the only ones, the same with my stomach, that happened for like a week after, like just out of nowhere. But the results have been fantastic. So I'm not sure what that means. I'm just highly sensitive. I don't know.
Wow.
Well, we knew that.
And I think one of the other things is everything is going to dissolve. So even if you feel like a little knot, because at the if I put 3 threads in, I'm going to sort of twist them around each other and pull them so that
Yeah.
they don't release,
Right.
which is when it's going to
What
keep
you
your
want.
result. But all of that's going to dissolve.
Yeah.
And that's going to be, it's not permanent.
No.
So
And
if
you
you
aren't
have a little
doing
bit of a
something.
lumpiness,
Yeah.
it's completely safe and
Right.
it will be fine.
Yeah, yeah, and you shouldn't massage anything or do stuff like
This
that.
particular one, no.
Yeah, so just leave it be. You'll be beautiful. You're
You
gonna
get massage while I do it.
Yeah,
So
exactly.
Sort of engage everything.
Not in a good one though.
No.
That's not a good one. That was not good. Let me see. So, yeah, okay. I was just gonna see. We're looking over our questions together. I guess what I want to know also when we were talking about who is a candidate for threading, and that leads me to, do you tell people no?
Oh, yeah, I say no, yes. I'll tell you.
Right.
If I don't feel comfortable, if your expectations are too high and I don't think that I can meet your expectations, so if you're really a candidate for a facelift, then
Yeah.
it's, so setting your expectation.
What is the time frame for results for these threads? How long do they last? Kind of what can I expect for this?
So typically you're coming in for fillers like maybe every 9 months to a year, maybe every 15 months.
Maybe a little more, depending if you
Depending
where
on
you
what
are.
it is. So these again will dissolve over 6 to 9 months, but the effect should last at least a year, maybe a little bit longer.
Right.
But you're still you're aging. The barbed threads or the threads for the lifting are going to are going to be immediate results. You're
Yes,
going to actually
yes.
see it actually lift.
And I'm going to try and insert some of those pictures that she took of me. I was like, oh my gosh. And it took care of this thing. So good. Already. Sorry, she's trying
No,
to
it's okay.
she's trying to clean me and do stuff.
Arnica.
Okay.
So we did 3. 1, 2. So
I didn't
that
even
is
know
going
I
to be
had
immediate.
that. Yeah.
Now the straight or the smooth threads, their job is just to build collagen. They are not supposed to pull anything
Right.
up, but
Make it plump it maybe.
you're going to start to see maybe 2 months, 3 months. That's more of a long-term.
Okay. Okay.
Which that's your long-term goal is
Right.
to have. We used to joke that the woman with the most collagen at the end wins.
Okay. So that leads me to my next question. How can I help myself with this effectiveness? Is there anything I can do? Is there a supplement? Should I be drinking extra collagen? What do you recommend so that I get the best results and longest results?
So number 1 is like a healthy lifestyle. So
So Jen, where else do you see, and go ahead, what are you doing? Where else do you see the threads being used per se? Like on the body, how do you see
So
this?
face would definitely be the most popular. Then the neck.
Okay.
A lot in the smooth ones in the chest, décolleté area.
Okay. Is that going to help with how our skin gets so
crepey
thin and the
and-
crepiness? Okay.
And I can't tell you how many times a girlfriend would like wake up in the morning and shoot a picture and be
Yeah.
like, "What the heck is this?
Right.
How do I fix this?" And then knees. That would be
Yes.
for the barbed thread pulling up the knees, and then you can also do a little bit of the collagen stimulation. Inner thighs, belly, the booty. So we've seen.
We're doing that.
And I have a bunch of longer straight ones or smooth ones. I was like, ooh, this would be good in the booty. Underneath the eyes for the smooth threads, you can do
So as opposed to doing a filler or a trough,
tear trough.
which I am afraid to do a little bit with that.
It's definitely an advanced filling technique, but if you use the right product and the right technique, cannulas are really good.
Yeah.
You're not-
Going right in.
Yeah.
Cannulas are amazing.
Yeah,
The whole
love them.
principle of it is crazy to me. You're going into your skin and poking through with blunt. You would think you need something sharp.
Well, you do make a pilot hole with the sharp
Yeah.
thing, but then
You're going
all the way
in and
through.
up. It's crazy. I don't know. This
Well,
is nice.
And then you are missing all the blood vessels.
Okay.
That's the good thing behind that. It's pushing things out of the way versus slicing through. So you
Oh.
get a little bit less bruising. In my opinion, you get a little bit more swelling because you're going through one hole and especially for your eyes. You're going in one hole, but then you're coming up and coming up and going up and coming up. But,
Okay.
you're just disrupting the tissue a little bit, but the bruising is a lot less and the recovery is pretty fast.
I just think it's so amazing. These are good. What were these? Just the asparagus? Wow.
Now, does your urine smell when you eat asparagus? Mine does not.
Mine does not. No, Mike's does. Yeah. No.
Normal variant.
No, mine does though very much with taking vitamin B. Vitamin B is so strong. It's like you open that up and you're like, who has the whole vitamin shop in my kitchen right now? Or if I have to take them really quickly. And then I guess to wrap this up so we can eat. What do you see on the horizon? Like, are there new things that you want to start bringing into your practice and to incorporate? Because I want the plasma pen. Jen's like one of the, and we'll be doing a video on that. I'm just a little bit of a chicken for this social downtime.
Yeah, social
I'll look really crazy. What else?
So, fat transfer. So taking fat and stem cells from usually your flanks.
Oh, that would be
and
good.
then injecting it into your face or your butt or wherever. That is exciting. And then the Sculptra has been around for a long time. I just haven't done it yet, but that's, I think when you do the threads along with the Sculptra, which is a collagen stimulating one too. So when if you want a little bit of volume and you're picking up with the threads and you want some volume over time, I think the Sculptra would be great too.
So I can't wait. When are you starting that? Let's get her going with that.
So we're gonna order that next week. Yes.
Yay! Stay tuned.
It's been around for a really long time. They're sort of revamping it, and I think it's a great thing because it's using your own collagen. It's stimulating your body to make your own collagen. You're not putting something foreign in and puffing things up. You're actually
With what?
So like
With the fat,
or
with the fat transfer or the Sculptra?
Sculptra.
Okay, so you're not putting a foreign.
So you're putting the polylactic acid in there, but it stimulates.
Okay, your own body.
Yeah.
Right. Okay.
Fat will be your own body and stem cells.
Okay,
Yep.
that's exciting.
That is,
all of that. Oh my goodness, I can't wait. Well, Jennifer, thank you so much. This is
Absolutely.
great. Thank you for all the information. Yes, cheers. Cheers to your health. Cheers to your pro-aging or anti-aging. Thank you so much.
You're very welcome.